In 2012, a new type of coronavirus was discovered, MERS-CoV, also known as MERS, which was transmitted from animals, in this case, dromedary, to humans, causing serious damage to the respiratory system. The first cases were reported in Saudi Arabia and Qatar, and although human-to-human contagion was low, the WHO issued an alert shortly after. However, the virus spread, both in the Middle East and in Europe, as many travelers, without symptoms, arrived home infected. As of today, several cases of the virus can be found. In most of these, the infected person was for a short time in the Middle East. Cases have been confirmed in the United States, France, the Philippines, Turkey, and South Korea, among others. New outbreak. COVID-19, SARS-CoV-2. At the end of 2019, a new outbreak of the virus emerged in China, today called 2019 nCoV, COVID-19, or Wuhan coronavirus. The epicenter was a market for live animals, and although its origin is not certain, it is believed to come from the pangolins. The first reported cases were of people who were in the market, relatives, medical personnel, and visitors who were in the area. The virus appears to be transmitted by close contact. After the report of the first cases and the taking of measures by the Chinese government, the inhabitants of Wuhan were isolated, while in other countries measures were extreme pending a statement from the WHO. Although initially, the WHO was cautious, in light of the new cases and the rapid spread of the disease, on January 30 the WHO declared an international emergency. By then, the virus had already reached Thailand, Japan, South Korea, the United Kingdom, the United States, Singapore, France, and Germany, among other countries. In March, the first cases appear in Latin America and Africa. Among the countries most affected by the virus are Italy, the United States, Spain, the United States, and South Korea. Currently, many countries have taken precautions such as isolation, border closures, cancellation of classes, public events, and the shutdown of transportation systems. Also, due to the spread of the virus, many supplies have been depleted. It should be noted that the virus is especially dangerous for the elderly and children. These are the most affected by the virus, as are people who suffer from other diseases at the time of contracting the virus. How to avoid contagion? As has been mentioned in the media, the best way to avoid contagion is to wash your hands regularly. Places where many people gather and hospitals should also be avoided if it is not an emergency. In case of symptoms or deterioration, attention should be requested through the means provided by each country. Isolation in this case could prevent contagion from others. Since there is still no treatment or cure for the disease, the patient's recovery depends on the care taken in the days after the infection. By November 2020, the first vaccine candidates appeared. By February 2021, around 10 vaccines had been licensed for public use. Symptoms and differences with the flu. The person infected with the virus will have a dry cough, fever, sore throat, headache, shortness of breath, and fatigue. Unlike the flu, the virus is not accompanied by sneezing, nasal congestion, or diarrhea. Chronology of COVID-19. December 31. China communicates about the outbreak to the WHO. January 1. The animal market, the epicenter of the virus, is closed. January 9. WHO announces to the world about the new type of coronavirus. January 11. First death. January 13. The virus reaches Thailand, first case outside China. January 16. First case in Japan. January 21. First case in the United States. January 24. First case in Europe. January 30. An international health emergency is declared. February 13. The number of infected rises to 46,997 worldwide. March 11, 2020. WHO declares the new outbreak a pandemic. Dear viewers, we have tried our best to provide you an informative video. Please comment that how did you find this video, because your opinion and comments are very important to us. If you like the video, please like and subscribe our channel so that you may be updated for our every informative video. Take care of your good self.